Here are 6 reasons you should skip straight to seeing a fertility doctor. Traditional advice is for people to wait till they've been trying for a year or 6 months if they're over the age of 35 to get a basic fertility workup. And a lot of times people will go to their OBGYN or primary care doctor and have a semen analysis, an HSG to make sure the tubes are open, and some hormone testing. We all know how time sensitive fertility is, so I want to talk about the specific results and situations where I would recommend going directly to a reproductive endocrinologist. So first, an abnormal semen analysis. If it comes back abnormal, especially involving low concentration or poor motility, don't wait. One abnormal test isn't the whole picture, but we do need more info. And so I would repeat the test, and if it's still off, I would refer you to our in-house urologist to do a deeper dive. They'll do a physical exam, a scrotal ultrasound, and hormone testing, like looking at testosterone and pituitary hormones like FSH and LH. If the total motile count, meaning the volume, concentration, and motility taken together, is under 10 million, IVF is usually the most effective option. But if it's still above that threshold, there could be a role for using IUI to boost your chances. And it's going to be much better and more effective than continuing to try on your own without help. Number 2, sexual dysfunction, male or female, that prevents you from being able to reliably have timed intercourse or being geographically separated. So if you're always missing the fertile window because of these issues, we can freeze sperm and take the pressure off. And with that, we can do IUIs so that you're not losing opportunities month after month. Another reason is irregular ovulation, irregular cycles. If your cycle is unpredictable, you may not be in the game. Ovulation is the key to having a chance to get pregnant. So if you're not sure or tracking is getting you nowhere, that is a reason to see a fertility doctor. Often we can use oral medications to get you to ovulate regularly depending on the underlying cause, and we can tell you exactly when to time intercourse. Another major reason is blocked tubes. If there's an issue with one or both of your fallopian tubes, we can help you figure out where the blockage is. Sometimes we'll recommend retesting. Other times we may suggest surgery to remove a damaged tube that could be getting in the way. If both tubes are blocked, IVF is your best option to bypass the tubes entirely. And if you're working only with one tube, we can try to make the process more efficient with options like medicated IUI. Another reason to see a fertility doctor is if you or your partner carry genetic mutations that could impact your future child's health. We can do IVF with a special kind of genetic testing called PGTM to help you avoid passing it on if you choose to do that. It involves doing IVF, and the earlier you do IVF in life, the better the odds, because you'll have more high-quality eggs to work with, because IVF is such a numbers game, and that extra advantage makes a big difference when you're testing embryos for more than one thing. The final reason to go straight to a fertility doctor is if you have a very low AMH or egg count. That doesn't automatically mean you're going to need IVF or that you have infertility. If you're ovulating, natural conception is possible, but it does mean that it's worth having a conversation with a fertility expert. We'll help you figure out, should you do further testing to look for underlying causes, or would it be smart to freeze eggs or embryos depending on when you're ready to start building your family and how many children you want. The bottom line is you don't have to wait a year and take a slow algorithmic approach. If something feels off, your gut is telling you you need more answers, listen to that voice, see a fertility specialist. It's not skipping steps, it's being proactive, and that can make all the difference.